Hi everyone, this is Brian with Skin and Beauty Center. Welcome to SBC's Patient Education Series. It's May, which means it's Melanoma and Skin Cancer Awareness Month. Joining us is board-certified dermatologist Dr. Kang to share helpful and educational information with you. Dr. Kang specializes in general, procedural, and cosmetic dermatology. An assistant clinical professor of dermatology at USC and a fellow of the American Academy of Dermatology. Welcome, Dr. Kang.
Hi, Brian. Thanks for having me.
So first things first, can you remind us of the difference and significance of detection versus prevention when it comes to skin cancer and melanoma?
Well, in detection, we're trying to find an existing skin cancer as early as possible so we can have the best outcome possible. Whereas in prevention, we're trying to prevent the skin cancer from existing in the first place.
Since we're focusing on prevention, is it possible for us to help ourselves?
Yes, definitely. The great thing about skin cancers compared to other cancers is that we really can decrease our risk by taking certain steps that we can easily incorporate into our daily lives.
What are some of the ways that we can prevent skin cancer?
The main focus in preventing skin cancer is to reduce our ultraviolet or UV exposure, most of which we get from the sun. So ways to reduce our UV exposure include staying under the shade, wearing clothing to cover up exposed areas, using sunscreen, and avoiding tanning beds. The other way we can prevent skin cancer is by doing regular skin checks with your dermatologist, where lesions which have a higher risk of turning into skin cancer can be removed or treated.
And how often should you get a skin check if you're concerned about getting skin cancer?
If you have no personal history of skin cancer, I recommend getting yearly skin checks by your dermatologist, just like you would for your yearly physical exams by your primary care doctor. I also think it's important to do self-skin checks about once a month to look for new persistent lesions and or changing moles.
Okay, and if, like myself, you've had skin cancer before, should you get skin checks more often? And are there any other precautions that I or we should be taking?
Yes, so for people with history of skin cancer, there are slightly different guidelines. For people with a history of basal or squamous cell skin cancer, I recommend getting a skin check every 6 months for a year, right after having a new diagnosis. If no new skin cancers are detected after that year, then it's okay to have your skin checked once a year after that. For people with a history of melanoma, though, because this is more aggressive, I'll recommend a skin check once every 3 to 4 months for about 2 to 3 years after a new diagnosis of melanoma, and then every 6 months after that.
So Dr. Kang, I have a young child, a very blue-eyed, blonde-haired child. Are there any considerations that I should take for him since I have a history of skin cancer?
So first, I want to mention that children are at very low risk of having skin cancer. Skin cancer risk will increase with age. So it's really unusual for a child to have skin cancers, although there are some rare genetic conditions that can increase the risk in children. Melanoma in particular is also very rare in childhood, but it is the most common pediatric skin cancer. So in regards to skin checks for children, if a parent or sibling has had melanoma or the child has a lot of moles, then I'll recommend a yearly skin check.
Dr. King, something I've always been curious about is all skin cancer caused by sun exposure?
So in studies, we found that 90% of skin cancers are caused by exposure to the sun. So the vast majority of skin cancers are highly associated with sun exposure, including indoor tanning. So that isn't to say that skin cancers can only be found on sun-exposed skin, like the face and the arms. Rarely, skin cancers can also be found in areas that have never been exposed to sunlight or very rarely exposed. So I've even found skin cancers on patients in between their toes and in the groin area.
Wow, where the sun doesn't shine. Speaking of sun exposure, summer's right around the corner. So what are some of the ways that we can pick the right sunscreen?
The main thing to look at when choosing the right sunscreen is the SPF. So SPF stands for Sun Protection Factor. And this shows how well the sunscreen protects the skin from certain UVB rays, which causes sunburns, skin damage, and contributes to skin cancer. It is recommended to use a sunscreen with at least an SPF of 30. And previously, we would tell patients that the benefit of these higher SPFs, like 70 and 100 plus, were unnecessary because theoretically, you didn't get that much higher benefit from these. But now we're finding that the way people are using the sunscreens, they're using a lot less than what's recommended, that these higher SPFs are actually helpful in preventing more sunburns. And a lot of patients will also ask me about chemical versus physical sunscreens. So chemical sunscreens contain molecules that absorb the sun's rays so that it doesn't damage your skin, whereas physical sunscreens act as a barrier to deflect the sun's rays off your skin. And both are very effective and very safe. I'll only recommend a physical sunscreen over a chemical sunscreen if a patient has very sensitive skin because there's higher risk of allergic reactions to chemical sunscreen.
And are there recommendations on how much sunscreen you should use and how often you should reapply?
The guidelines say to achieve the full SPF of whatever sunscreen you're using, you need to use 1 ounce, which is a shot glass full of sunscreen to cover all the exposed areas of the body. And most people will use significantly less than this, which means that most of us are getting only a fraction of the SPF that's actually stated on the bottle. So practically speaking, I'll tell patients that when you're applying the sunscreen, it should take about a minute or so to rub in the sunscreen. If it absorbs right away, then you're probably using too little. In terms of how often to apply, if you're going to be indoors most of the day, I think 1 application to the sun-exposed areas in the morning is fine. And if you're going to be outdoors for longer periods of time, then reapply every 1 to 2 hours because the sunscreen starts breaking down after that point. And remember that people get sunburn during cloudy days too, so you want to make sure to wear sunscreen at least once daily, no matter what the weather looks like outside.
So I, like a lot of people, hate that sticky, greasy feeling that you sometimes get from sunscreen. Are there any ways to avoid that, or is it just something I have to deal with?
No, so in general, sunscreens that have a higher SPF and mineral sunscreens will be thicker and stickier. So for people who have a hard time tolerating sunscreens, I'll recommend using a lower SPF, like SPF 30, and then finding sunscreens that don't have titanium dioxide or zinc oxide, which are the active ingredients in mineral sunscreens. And although I think that lotion sunscreens are more effective for someone who doesn't like the feel of these and ends up not wearing any sunscreen at all, I think the spray-on sunscreens are a good alternative. For someone who wants to avoid sticky sunscreens and still wants a physical sunscreen, then there are some brands that make a thinner, more elegant physical sunscreen, but these are going to be a little pricier. But these days, there's so many different kinds of sunscreens that are available that everyone should be able to find a sunscreen that fits good to them.
So whenever I'm active outdoors, the sunscreen and the sweat tend to mix together, get into my eyes, and cause a problem. So are any recommendations on how to avoid that?
Well, I get asked this question a lot, and it's a more difficult question to answer. I don't have a foolproof sunscreen that's good for these situations, but I have found that the sunscreens that come in sticks seem to be less likely to run into the eyes. And I also find that physical sunscreens sting less than chemical sunscreens. And then there are some higher end brands that will also make sunscreens specifically formulated to be used around the eyes that claim that they don't run into the eyes and irritate them.
So we're talking a lot about sunscreen, but it's not just about sunscreen, right? Does clothing play a part in preventing skin cancer?
Yes, so clothing is actually much better at protecting skin from the sun. So when possible, covering up with clothing is best, and then use sunscreen for any exposed areas. Although you can buy clothing specifically made for sun protection, which has a higher SPF, I don't think this is necessary. Your regular clothes will also protect you from the sun. And don't forget your wide brim hat. If you have thinning hair, a hat is the easiest way to protect your scalp skin. And even without the thinning hair, this will not only protect your scalp, but it'll also provide protection for your face and your ears.
All right, and since summer is right around the corner, we're going to be going to the beach and doing a lot more outings. What are the top 3 things you would recommend to go in any travel bag?
Yeah, so when I plan on going outdoors all day, I'll always bring with me at least 2 to 3 bottles of sunscreen, including lotion and a spray-on, a wide brim hat, and a light piece of clothing or sarong to cover my legs or shoulders if the sun gets too hot. And then if I can, I'll also bring a small pop-up tent to sit in.
Good idea. Many people love that bronze tan look, that glow. Is there a safer alternative to sitting out in the sun, indoor tanning, or anything else?
So tanning from any UV source, including indoor tanning, increases your risk of skin cancer. And in fact, indoor tanning might be worse for our skin because the bulbs that are in the tanning beds emit 3 times more UVA light and almost as much UVB light as the sun. So I definitely don't recommend doing indoor tanning. If you want to have that tan look without the risk, then I recommend using a self-tanner. And then I also want to add the reminder that UV light not only increases your skin cancer risk, but it also ages your skin much more quickly too.
A lot of great information, Dr. Kang. Thank you so much. Again, if anyone would like to get in contact with Dr. Kang or with any one of our dermatologists here at SBC, there are a few ways that you can get in contact with us. One of them is texting or emailing us at hello@dermla.com. That's hello@dermla.com. You can give us a call at 877-822-2223, or you can visit us on our website at dermla.com. Dr. Kang, thank you again so much for joining us and giving us this wonderful information.
Thank you.